Ocala's information station, 1370 WOCA. Ocala!
It's 5 minutes after 11 o'clock. Dr. Riadh Fakhoury is in the studio. You knew that because you heard that music. And it has become synonymous with Dr. Fakhoury. If I ever walk into the Fakhoury Medical and Chiropractic Center, make sure I say your name right, then I will expect to hear this music just as I'm walking in. This is the Head to Toe Care Show hosted by Dr. Fakhoury. And if you have a question for Dr. Fakhoury, that's why he's here, to answer those questions. So call him right now. The number is 622-WOCA. That is the WOCA Climate Control Source Hotline, 622-9622. Good morning, Doctor.
Good morning, Larry. How are you?
Pretty good, pretty good. We want to talk about trauma.
That's a good subject.
I have a question, and I wonder if this is considered trauma.
Okay.
Are you ready?
I'm ready.
My mom had a medical procedure. The procedure required her to lie on her belly while they did whatever they did through her throat. It's amazing what they did, and that's all I really need to tell you about that. But the point is, she was lying on her belly the whole procedure, which may be about an hour. It ended up giving her this bad backache. Is that trauma? Just laying on one? Is that considered trauma?
Well, trauma, usually when we think of trauma, we think that there was some force put onto the body, and that there's something, an incursion that's coming against us and putting some undue force into our joints or into our musculatures or into our skeletal system, what we call the neuromusculoskeletal system. But laying there, yeah, you could consider that maybe a low force type of trauma, because she was laying on her belly, and what happens when you lay on your belly is the back sags and you get a lordosis, or more of a curve of the low back, and then that causes the joints to pinch each other. And it's called imbrication of the facet joints, which is where the parts of the spine that lets you move, and the joints basically start jamming and pinching, and it could be very uncomfortable because there's a lot of nerve endings around those joints, and when you stretch the joint or you jam the joint, you're going to cause pain, and that's interesting. Topic that we might talk about is, what after trauma? What's causing pain? Is it the muscle? Is it the nerve? Is it a fracture of the spine? Is it torn tendons and ligaments? Is it inflammation and bleeding? Is it maybe the joints that are causing the pain and not the disc that's causing the pain? Is it the disc that's causing the pain? So maybe we could talk a little bit about that also.
Okay. Yeah, and I guess it was the fact that she had the backache for 2 days, and I was thinking about your 3-day rule.
Right.
I was thinking, Mom, third day, Dr. Fakhoury.
In the car into the office.
Yeah, and she's, it's just, one of those things, she's up there in age, and I don't want her to, have anything that causes her to go downhill, if you know what I mean. So.
At 2 days, she went back to baseline where she normally feels.
Everything looked normal.
That's good.
Felt normal
That's
for
good.
her again.
And, if somebody's had a recent surgery, for example, I had a patient call in today, actually the husband for the patient. She just had surgery on her shoulder on Friday, and asking about what we can do to take care of her because of having some problems. And really, we have patients coming in sometimes 2 days, 1 day, 3 days after surgery. We just avoid that area. We work around it. If we normally lay the patient down, we get them sitting. If they can't sit, then we stand them. We find ways around that to be able to implement gentle, effective, safe care for that patient, so that way they don't have to suffer. So whether you're 80, 90, 95, you could still come into the Fakhoury Medical and Chiropractic Center, and what we do is work around the procedure. And, for example, we've had people come in wheelchairs. They just scoot forward a little bit in the wheelchair, and we can use the activator, which is a very gentle treatment for the elderly or for children, and realign their spine with that, and have some dramatic response.
Okay. We do have a phone call, and before we go to the call, let me just remind the listeners you can call with a question, and the way to do that is with the phone. The number is 622-9622, and you can also text a message on the WOCA.com website. If you go there right now, you will see the streaming video of Dr. Fakhoury. In the upper right-hand corner at that screen, click the thing that says Ustream, and that will take you to the host of that site, the host site, which is the Ustream site. the reason you would go there is because that's where the text box is, and you can type a question. I will read it to Dr. Fakhoury, and then he will answer it. All right, now let's go to the phone. Good morning. You're on the air with Dr. Riadh Fakhoury.
Hey, good morning.
Good morning, sir.
I just wanted to find out, do patients go in ads for, like, getting the tonsils out?
Okay. So what we might have is a patient coming in that has recurring sore throats, might have recurring ear infections, and they may come into the office wondering if that could be coming from the neck. For example, what we see in situations like that most often is patients are going to come in with recurring sore throats or ear infections and say, I've gone through 2-3 bouts of antibiotics. Do you think my neck might be causing some of the problems? And in that scenario, we have a medical doctor on staff, Dr. Shanawani. He doesn't practice as a primary care physician, though he's knowledgeable in it, but he will take a look, and if he feels it's more medically inclined, like you're saying, maybe some inflammation or infection of the tonsils, then he'll refer that person either to their primary care physician or refer it on to their to a surgeon at that point, and then give it to the right person to take care of. If it's a drainage problem because the neck is out of alignment and the ear is backing up or the sinuses are backing up because they're not draining properly through the neck, then we can adjust the neck, especially the first bone, which is the atlas, and help improve the drainage of the sinuses in the head, which will help slow or reduce the recurrence of infections, because as long as flow is going through the head and the sinuses, then that person will have less likelihood of having infections. So if it's something we can take care of, we will, but things like tonsillar infections, tonsillitis, we would refer that out to the primary care or a surgeon.
All right. And I think you have another phone call. Good morning. You're on the air with Dr. Fakhoury. Good morning. Oh, maybe not. Maybe not. If you have a question, again, the number is 622-9622. And by the way, I meant to mention that now Ustream, you can watch Dr. Fakhoury on your smartphone.
Really?
Yeah, if you just go to Ustream, you'll see the download. You'll see how to put that app on there. And you can watch you in your car or whatever, while they're jogging or whatever.
Jogging is better. Be careful while you're driving.
And speaking of jogging, I mean, that's a slow-moving opportunity waiting to happen for trauma, right?
It is, and that is a case of trauma, because what happens in a scenario like that is when you are jogging, you're putting undue force onto the joints, and then that definitely can cause some wear and tear. We'll talk about that later. I know there's a caller in.
Yes, sir. Good morning. You're on the air with Dr. Fakhoury.
Yes, good morning, Dr. Fakhoury.
Good morning.
It's your favorite friend.
I always appreciate your call.
Oh, I love talking. Your program is just, thank you very much, all I can say. Say, we just got through with the Summer Olympics in London, and the wife and I really enjoy watching the gymnasts, and it's almost torturous to watch them maneuver their bodies the way they do. Do these people need any chiropractic application or help before, during, or after all those twisting things they do and everything else?
Definitely, yes. And you'll find that most athletes are utilizing chiropractic now to help improve their performance and reduce the chance of injury. Because our job is making sure that that body is working properly. Less stress on the joints, less stress on the knees, and if the pelvis is balanced, the spine is lined up, the muscles are going to perform better, and that person is going to have better production from their body. They're going to have less chance of injuring and then a better output. So athletes find they perform better when they're getting chiropractic care. Now, about the tortuous movements, they usually start these kids at 3-4 years of age, very young. The bones are still soft, so they can get the bones to mold in very unusual patterns where they can arch their back, where Larry's mom laid on her tummy for 2-3 hours. She couldn't tolerate that because her spine doesn't have the flexibility for that. These young men and women have taught their spines to be flexible. In fact, usually the female gymnasts, when they're arching all the way backwards, they actually produce a fracture of their spine at the L5 vertebrae, where it separates the bone, allowing the front of the bone to go forward so they can arch all the way backwards. It causes what we call spondylolysis, which is the fracture, and spondylolisthesis, or forward movement of the bone to allow them to arch backwards more. And they do perfectly well as long as their muscles stay tight. But once they stop their sports, then they start having some problems with their back.
Do these young athletes, when they're starting out real young, would they go to a person like yourself and have X-rays taken, make sure that the back can take it, the spine and this muscle and that bone and that before they get involved and do some damage?
Usually with the youth we don't X-ray them, especially when there isn't any trauma. Now, if there's been trauma, if we're worried about a fracture, an injury, if there's possibility of a scoliosis and we want to tag it and watch if it progresses as time goes on, at that point we'll take an X-ray. But usually if we have a healthy young individual, all they need is an adjustment and alignment, and they do very well with that.
Okay, well, thank you very much. It was a very interesting conversation.
Thank you. Thank you very much.
Dude,
I know.
We live in horse country. Every once in a while you'll hear somebody getting stepped on the foot. The horse will step on their foot.
Yes.
Is that something you would adjust and repair that way?
We would check it, make sure there isn't a fracture, and if it's more of a structural problem, then at that point we can usually do some manipulation, and if they can't tolerate manipulation, we can do the ultrasound or laser or some type of rehab or physical therapy or physiotherapy to help them.
I'm guessing you've had your share of that, am I right?
Oh, we've had bites, and we've had stepped, and we've had pushes by horses, and we've had a lot of things come in related to horses.
Maybe kicks?
Kicks, falls, fractures, a lot of things.
Good morning. You're on the air with Dr. Fakhoury.
Good morning.
Good morning.
I just wanted to find out. Well, actually, I have two brothers and one sister in the medical field, and I was wondering. I know there's a whole lot of things you have to go through to be certified. I just wanted to find out a little bit more about that, and also I just want to know how to do. Anything else pertaining in that field.
All right, wants to be a doctor.
Okay, very good. If we're talking specifically about becoming a chiropractic physician, what you want to do is you have to go through an undergraduate program similar to a pre-med program. It could be a physiology. It could be, there's just a biology program. But you have to get your 4-year undergraduate bachelor's. At that point, you'll apply for the chiropractic college, just like you would a medical university, chiropractic university. There's many of them around the United States. In fact, my daughter is now actively studying the different chiropractic colleges as she's planning on going into the chiropractic school.
Wow.
So then when you get into the chiropractic college, you'll find that it's usually a 5-year program, usually a 10 to 13 semester program, and it'll take sometimes the schools will do it year-round with only 2-week vacations in between instead of taking summer off. And that trimester will finish it in under 4 years, but it's usually a 5-year program that you have to go through. And then you get your Doctor of Chiropractic at that point. And the program's very aggressive. You may be doing 30, 35 hours of classroom time every week. So it includes anatomy, physiology, it includes psychology. There's just a histology, just a host of programs that you go. It's very similar to the medical program, but where the medical excels into surgery and into medications, we focus more on the chiropractic at that point. But our basic knowledge and knowledge of the body is very similar.
And you are also an orthopedist, so that's a whole other area of education you had to go through.
You can specialize after you get your Doctor of Chiropractic. There's different fields you can specialize in: neurology, orthopedic. You could specialize in neurology, orthopedic, radiology, sports medicine. My focus is to becoming a chiropractic orthopedist, which was again another 5-year program to really specialize on the intricacies of the body and how it works, so we can help the more complex cases. And sometimes we'll find referrals coming in from medical offices, even other chiropractic offices, because the cases are a little more complex and they like us to handle those cases. Plus, at the Fakhoury Medical and Chiropractic Center, we have some different areas that of care for those patients, like the interventional medicine and the rehab and other things that some offices don't have.
All right. Again, the phone number here is 622-WOCA. The website is WOCA.com. Click on the streaming video in the upper right-hand corner, and it'll take you to the page on Ustream where you can type a question on in the text box. You can also download the application so you can watch Dr. Fakhoury's broadcasts on your smartphone. And we have another call, so let's go to the call. Good morning. You're on the air with Dr. Fakhoury.
Good morning, Larry. Good morning, Dr. Fakhoury. This is June.
Hi, June. Good morning.
Good morning. How are you? I have a question for you.
Yes, ma'am.
How many floating ribs do you have? do I have?
That's a great question. Usually what happens is ribs, the first to the 10th rib are connected to the front, to the sternum.
Yes.
And the 11th and the 12th rib, definitely the 12th rib is usually floating. The reason they call it floating is it doesn't come in and it attach by cartilage into the sternum in the front. So you have two little ribs just sort of hanging out there and floating off of the spine, off of the 12th vertebrae in the thoracic spine or in the mid-back.
Okay, because I have had such a bad allergy and I've had this dry, hacking cough. I know I sound like a hypochondriac, and I'm not.
You're not.
But after I coughed so much, I touched the back of my ribs where the floating ribs are, and I heard something pop.
Right.
And that thing has been so sore ever since to the touch, I can't tell you.
Yes. Well,
Is it possible to fracture a rib like that?
It sure can be. And what happens, June, is because it's not locked in and stabilized with the sternum, when you cough, that rib just jerks very rapidly in a quick motion, and at times it could either slip out of position, which is easy for us to put back into place, and there's no need to suffer with that. Or secondly, if it's a fracture, at that point, then we have a very nice rib belt that can help you as long as it doesn't restrict your breathing or affect you and give you the possibility of upper respiratory infection, and that will give you a lot of relief. So when you get a chance, just call, come on in, let's check that rib out quickly, and we'll see which one of those two could be bothering you.
Oh, I will do that, Dr. Fakhoury. Thank you so much.
You're so welcome. Thanks for the questions, June.
Okay, bye-bye.
Bye-bye.
So when you stabilize something, is that one way to treat trauma?
It is. It is. And sometimes the best treatment is leaving it alone and just putting a brace on it, putting a support on it, and just letting it rest, bring the inflammation down, and then approaching it at a later point when it's not so hot and not so angry, and you have a better opportunity. So sometimes the course of treatment is immediate, other times it's not. Like, for example, we bumped into a gentleman yesterday, Dr. Teeter and I, and the gentleman had an accident. It was a pretty severe accident. He was the passenger in a vehicle where he was T-boned at 80 miles an hour on his side.
Oh, my goodness.
And unfortunately, he didn't really receive...
That's huge.
It was huge.
80.
He was so fortunate to be able to walk away from that, he and his fiancée. So what happened is that he survived, everything's fine, no fractures, but he's been injured. The muscles were torn, the ligaments were torn, his whole head was shifted over because of the spasms of the neck.
Wow.
Just a couple treatments, but really didn't follow through because to be able to treat trauma, you have to be experienced in it, and you have to really have a program to get that area to heal properly. Well, a few adjustments didn't take care of it, and now it's 4 months later, and I looked at his neck, and I said, I can tell you were hit from the side. He says, how did you know? So I took a picture of his neck, and on the left side there was a nice contour to his neck. On the right side, it was straight down, swollen, and off to the side. I asked him when the accident was. It was 4 months ago, and now he's starting to get the numbness in the arm. And he's getting pain in the mid-back under the shoulder blade, and it's getting worse. So I told him that we need to address it immediately because now it's not an acute or recent onset, it's chronic. And it's been there, and the body's built a shell around it thinking this is normal now, which means that he'll have a lot of problems, as Dr. Teeter said. Over time, he'll probably become a surgical candidate if we don't intervene with conservative treatment. Get the head back over the shoulders the way it's supposed to be, relax the muscle, reduce the inflammation. Now we have scar tissue, so we have to have our massage therapist break the scar tissue up and get our rehab specialist to start stretching that neck and elongate those muscles that are tight and short, and they actually build little scars in them that won't let that muscle stretch back out, so we have to manually stretch them out. And it'll take probably, now that he waited this long, a good solid 3 months of care to get that neck to elongate, bring the curve back where it needs to be, and bring the contour back of the neck so he's equal. His fifth vertebrae is out of alignment on the right side. That's pinching the nerve that goes down to fingers 1, 2, and 3, the thumb and the first two fingers. And sure enough, he said that's right where the numbness is. And now he's having difficulty sleeping at night. And you can see where it's progressing, and that's why we really stress the experience that we have of 27 years of treating trauma and having a multidisciplinary approach to pick and choose what the best form of care is, that person who's been in an accident, whether it's a trauma motor vehicle accident like this gentleman or a sports injury, needs to get in immediately, because if you don't, you can ignore it, but eventually the pain or the limitation will supersede or override the ability to handle the pain, and it'll get to a point where that person will have to come in, but it's so much harder to undo the damage later than it is more when it's more recent.
And not to belabor the point you made last week and the week before, but there's another example of why, if you're in an accident, you need that. If they limit you to 14 days, go the first 14.
Yeah, and the problem is, by the time you go to the hospital, by the time you go to the medical doctor, by the time they tell you to get in to the Fakhoury Medical and Chiropractic for treatment, it may be day 15, 16, 17. The days roll so quickly. You're worried about your car, you're worried about your kids, work, this and that. But really, get in, at least get the evaluation, which shows if you've been injured, we know it. If you're not, we clear you. And then that way, at least there's documentation. So if 2-3 months down the line, like this gentleman, the arm is going numb and the stabbing pain in the shoulder blade, then the file has some documentation so the adjuster can look back and study that and have some information, as opposed to not having anything and wondering, well, how do I correlate this together?
You have a question online.
Oh, good.
It's coming in.
This is the first one. Look at it.
First one today.
Oh,
yeah.
Great.
He says, I got orthopedics inserts for my shoes 3 years ago. Do I need to get a new prescription?
Another great question. You know, the listeners, we have a real educated group of listeners that come with excellent questions. And the orthopedic inserts for the shoes are called orthotics. And if it was a hand-casted orthotic sent to a laboratory, custom built for that individual and brought back and checked to the patient's foot to make sure that it is correct, that orthotic could last as long as 5 to 6 years. The only time that we have to make another orthotic prior to that is if the foot changes and we have to make some modifications, and that happens sometimes, or if the orthotic is not made of the right quality and it starts to break down, then we need to make a new orthotic. Usually the orthotics that we make for heel spurs, plantar fasciitis, flat-footedness, bunions, pain under the ball of the foot at the Fakhoury Medical and Chiropractic Center will last 5, maybe sometimes even up to 6 years.
Okay, thank you. So thank you. Now, so that sounds like eyeglasses. You need a prescription. I never knew that.
Well, yes. If you're getting a custom-made orthotic specifically for you, which is what we do at the Fakhoury Medical and Chiropractic Center, as opposed to go to the foot, the store, the shoe
off the
store,
shelf stuff, yeah.
And just pull it off the shelf. One is custom and one is general. So if you go to one of these supermarkets and grab some reading glasses, that's general.
Yeah,
if you go and get it checked and it's made exactly for you, it's custom. The more customized, the more effective it'll be, and the more you're going to get out of it.
Yeah, I would imagine the safer it is. Maybe
that's
it's
true.
a better word, right?
That's true. And by the time these are not inexpensive. You pick it up off the shelf, sometimes it's $50 to $90.
Yeah.
And you don't know if it's going to work or not.
Right.
And they're general. They're just based on shoe size, not based on your function of your foot.
Do we do anything ourselves when we have trauma? Just to get back to that just for a moment. Let's say I accidentally hit my arm on something and it's swollen.
Well, let me give you an example of what happened.
Okay.
Somebody sitting at a light, just looking straight ahead, boom, gets hit behind.
Right.
And that happens all the time. I tell you that driving around Ocala, I'm seeing more and more accidents. I'm seeing tow trucks moving everywhere. I'm seeing ambulances back and forth. Our incidence of accidents is going up on the streets, which is why it's important for us to make people more aware of what to do when you get in an accident. Don't ignore it. Get it evaluated. For example, you have a pain in your stomach, you don't ignore it. Get it looked at. If you have an ulcer on your arm, you don't ignore it. You get it looked at. So
that's right.
If you're in an accident, go to somebody who's experienced and knows how to take care of those problems or evaluate them and get it looked at. So in a scenario like that, the first thing you should do is get ice on it. If you think that you've been hurt where it's life-threatening, go to the hospital. If it's not a life-threatening injury, within 14 days, give a call to somebody who's experienced in taking care of those traumas. Like, for example, at the Fakhoury Medical and Chiropractic, as we said, 27 years we've been doing that. Our medical doctor on staff, Dr. Sharon Awani, who's a full-time MD, has been dealing with urgent care and emergency medicine for 25 years, so he knows ins and outs of trauma. He's found ulcerations. He's found where the retina is detached from the eye on one. He's had somebody airlifted to Shands after they found a laceration of an organ. He's diagnosed people who've had concussions. And so it's, you want to make sure that you get it evaluated and get it looked at professionally.
And a good place to go would be the Fakhoury Medical and Chiropractic Center. And what's the number over there?
The number is 351-3413, 351-3413, and we are there Monday through Saturday. If you press number 4, it takes you to the front desk or our patient care coordinator, Amy, and somebody will be happy to answer your questions. If you have questions on insurance, we can pre-verify that. We have adequate staff for that, and adequate staff to get you in immediately if you need some help.
All right, and of course you're located at 1009 Southwest 16th Lane here in Ocala, right over Governor's Bridge.
Right between 441 and 200 as you're going towards 200 on the right-hand side at the bottom of the bridge.
And the only other information, I guess, is the website. It's headtotoecare.com, toecare.com. And by the way, all of these broadcasts are available as podcasts.
Fantastic.
I got them up yesterday.
Well, good. I'm going to go to my app store, and I'm going to see how Ustream is U or Y-O-U?
U.
Ustream.
Ustream, yeah.
And then WOCA, or how do you go from there?
No, I think if you go to Ustream, you can download the app and watch all of the Ustream things, but I'll be honest, I don't know. I'm looking at it on here. It's advertising it as I'm looking at you. So
we're going to have to find out how to get to WOCA.
I'll show you how. It's right in front of me right now.
Great.
Hang in there. We'll take a little break and we'll be right back. Thank you, Dr. Fakhoury.
Thank you, Larry. Do you wonder why you continue to experience pain? Is your daily routine affected by your body telling you that it hurts? Let us explain why this may be happening to you. Every Wednesday at 11 a.m. on the Head to Toe Care Show, this is Dr. Riadh Fakhoury, board-certified chiropractic orthopedist at the Fakhoury Medical and Chiropractic Center, available to serve you and answer any questions that you may have. Again, that's on the Head to Toe Care Show every Wednesday at 11 a.m. on WOCA The Source, 1370 a.m. and 96.7 FM.
Ocala's information station, 1370 WOCA. Ocala.
The weather is brought to you by myfwc.com. Life jackets save lives. Where in Florida? Partly sunny skies today. There'll be a thunderstorm or two around, mainly during the afternoon and evening hours, the high 88 to 92. And partly cloudy tonight, low 70 to 74. For tomorrow and Friday, times of sun and clouds with a thunderstorm popping up during the afternoon and evening hours each day. High will stays 87 to 91. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
In specialty crop news from the Southeast AgNet, well, for organic farmers and processors, the cost for certification or recertification averages out to about $1,000 every year in order to label and sell products as organic. However, the 2000